Hello everyone, my name is Kirsten Tingle and today I will be speaking about concussions in general, but also concussions that can occur in sports like pickleball. So the objectives of this video are to discuss what a concussion is, discuss how concussions are diagnosed, discuss the risks associated with the injury due to the symptoms, and discuss the treatment and rehabilitation that could be used for a pickleball player or any athlete returning to play. So to start, what is a concussion? A concussion is something that needs to be taken pretty seriously because it is in fact a traumatic brain injury. What this means is that something has occurred to where the brain has a bruise or maybe bleeding inside of the head. It can be caused by a fall or an accident. In sports especially, you'll see people that will trip and hit their heads or be hit in the back of the head with a ball or a racket, especially in racket activities like pickleball. But there's a stigma that you have to hit your head in order to get a concussion, and that is not true. You can get these by way of accident, being jarred around in a car. You can get them by getting whiplash in a similar incident. But you do not have to hit your head in order to bruise your brain. It is all about the brain actually hitting the skull. So jarring around can cause these brain bruises and bleeding. Diagnosing a concussion starts by recognizing signs and symptoms. On the right-hand side, you see a brain that has a bandage on it, and around it is listed a bunch of signs and symptoms of concussion syndrome and post-concussion syndrome. You can see confusion, blurred vision, nausea, headache, oftentimes fatigue, vomiting, lack of concentration, sensitivity to noise, easily distracted, and not all of these will be present in every patient, but if symptoms are present, that leads to physicians wanting more information, which is where they will send their patients on down to radiology to have an MRI or a magnetic resonance imaging done, or a computed tomography or a CT scan done of the head. The CT looks more for brain bleeding, whereas an MRI can see more of brain bruising. So depending on the severity of the concussion that they've seen, based on your symptoms and presence of any cuts or bleeding on the outside of the skull, they'll send you to get one of these tests. Levels of severity of concussions vary, but they're divided into 3 grades. Grade 1 is a mild concussion, grade 2 is a moderate concussion, and grade 3 is severe. The difference between 1 and 2 and the 3 specifically is that the severe concussion, is when people lose consciousness right after hitting their head. Grade 1 concussions are characterized, you can see on the screen, by nausea, dizziness, lack of concentration. They occur in minor car accidents and athletic events and at-home mishaps. This is where you trip and fall and hit your head. Grade 2 moderate concussions have a lot of the same symptoms, but they tend to be more present. And they can also include loss of consciousness for a brief period of time, whereas grade 3, you will lose consciousness and be unconscious for a long duration of time. Victims can experience amnesia, as seen in the language there, and they may present more symptoms as well as stronger symptoms. This is a sign typically of a contusion, which is where your brain is bleeding, versus a concussion. So it's not just a bump to the head. You can see there it is actually a brain injury that we can see in these scans that requires medical intervention. So the impact of the injury, it can have short-term and long-term effects depending on if it's treated properly. On the right-hand side, you can see a concussion checklist of symptoms and signs as we discussed in the beginning of this video, where you'll see headaches, nausea, balance issues, sensitivity to light, and confusion are considered symptoms, whereas appearing to be dazed and can't recall events or like missing periods of time are considered signs of a more severe thing than just a headache. Short-term effects are typically these symptoms, where you're going to see the patient present headaches and sensitivity to light and not be able to concentrate. Computer screens make their head hurt. It's a combination of these things. They're very tired and they don't necessarily want to do activity. Long-term effects, if not properly treated, can lead to a continuation of these symptoms for a longer duration of time. This is up to months, whereas if treated properly, concussions can be healed in a couple of weeks. Long-term effects, as seen on the left-hand side, can also result from having multiple concussions on top of one another, so not allowing proper time for the first to heal and then engaging in activity that results in another concussion. And this can cause long-term memory loss. It can cause issues with motor and sensory because all of your nerves run into your brain. It can cause emotional distress and depression oftentimes as well, because if athletes are used to being active and they no longer have that physical activity, a lot of times that is a support system for them and results in a decrease in those happy chemicals, quote unquote, in the brain. So treatment for a concussion is to treat the symptoms, because they're all different. Everybody demonstrates different symptoms. To rest more than anything, because the best time for your brain to heal is when you are asleep. Treating the pain with medications like over-the-counter NSAIDs, such as ibuprofen or naproxen. Resting, again, lots and lots and lots of sleep, and decreasing physical activity, as well as some people need to go into emotional therapy to kind of get their brain back on track after losing the ability to do physical activity for a duration of time. So for athletes in particular, there is a return to play protocol that athletic trainers will administer, and they begin with zero activity. They are cut off from a lot of school activities. They're cut off from sport activity. They're told not to engage in physical activities such as PE classes until they can demonstrate 24 hours of being symptom-free, where they don't have headaches, they don't have that sensitivity to light, they feel not sluggish. The second phase is where they get to engage in light aerobic exercise, and this is just increasing the heart rate a little. This is walking and swimming and stationary cycling, but it's not for a long duration of time, and it's not meant to be a high intensity. And then again, you go into the can you demonstrate no symptoms for 24 hours? If yes, then we move on to phase 3. Sports-specific exercises, so as for pickleball, they would begin to get back into the serving motions and getting to move the racket, but maybe not necessarily including a ball, because they could risk hitting their head again. So then if they can make it through this without presenting symptoms for 24 hours, they can move on to stage 4. And this is non-contact draining drills, which is again getting into that motion, but not interacting with other people by way of pushing them around, because you don't want to risk falling and hitting your head again. And finally, once you can demonstrate being symptom-free for 24 hours, after that, you get to move back into full contact practice. This is where you are considered released, and your athletic trainer will grant you the ability to integrate all of your activity again, and you can return to your sport as a released athlete. So for others who are not necessarily athletes, that may be in badminton or pickleball or racket activities like that don't necessarily require you to be a professional athlete, it is important to remember that the final steps of recovery, just in general, after all that rest and treatment, are to return to activity slowly, reintegrating your sport-specific activities slowly, or your busy and complicated activities of daily living slowly, and reestablishing your coordination, because you have just caused your brain some distress. So it may take some time to build back that muscle memory or the tissue from the neural perspective, and like reconnecting bilateral movements and contralateral as well. Remember that when you're treating any kind of injury, that no two people are the same, so it's not fair for one person to base their recovery time off of another person, especially athletes that are in different sports. So it is very important to remind your patients that their recovery is not going to be like someone else's, because their injuries are not exactly the same, because they aren't exactly the same. Thank you for watching my video. Here are some resources where I got my information, and I hope that you learned something from watching this today.